Can you take hair fall treatments before marriage? Now, I'll answer this question in a couple of ways because I'll give you some quick pointers on how you can execute a hair fall treatment plan, especially in the context of marriage. Now, marriage becomes an important decision for all of us, and we want to look the part. It really doesn't look good if you're going with the receding bald hairline, and many men usually tend to take hair fall treatments 6 months and sometimes maybe as early as 3 months before marriage. But the biggest mistake that men tend to do, and a cardinal point to bear in mind, is that these medications increase the risk of erectile dysfunction. Now, please bear that in mind. If you take tablets like Finasteride, Dutasteride, and sometimes even scalp serum applications of Minoxidil, we have seen lots of patients complain of erectile dysfunction, decreased desire, decreased interest, low libido, and a range of other complaints, right? Especially with medicines like Finasteride and Minoxidil, we see this. With Dutasteride, we have also noticed patients complain of ejaculatory dysfunction and decrease in semen volume. So, to prevent these negative effects, what can be technically done is you plan for your hair fall treatment or receding hairline. Plan it at least 6 to 8 months in advance, right? 3 months before your marriage, please come out of all these medication and take counter drugs to improve testosterone. Now, again, you need to have a proper workup of the hormones. It has to be worked out properly, and only then counter medications should be given. Blind medications to improve testosterone, I do not recommend, mind you. Go visit an andrologist, go visit a male fertility specialist, give your hair fall prescription, take a consultation, get a premarital check done, validate your hormones, and take counter meds. That's how you solve the problem. And remember, 3 months before marriage, don't take any medicines. Try to stay away from these hair fall medicines 3 months before marriage, because all hair treatment plans and procedures generally require a long-term time vision. So you need at least 6 to 8 months or a year. So say your marriage is going to be in the next year, or say December you're getting engaged, next year July or August. Yes, maybe for 3 months you can take Finasteride, Minoxidil, or Dutasteride, but not 3 months before marriage, right? Never do that. Okay, can you undergo PRP therapy? Yes, PRP therapy for hair fall is generally safe. You can undergo PRP therapy, but consult with a trichologist, of course. Follicular unit transplantation before marriage is also safe. There are no problems there. But post follicular unit transplantation, many doctors put patients on Minoxidil because the hair follicles that are newly implanted should not fall off. So Minoxidil is commonly given. So consult with your trichologist. Tell them explicitly that marriage is planned, because most hair specialists and dermatologists don't seem to tell the patient that there's a real risk of ED while giving these meds. So plan it well, and general advice: 3 months before marriage, do not take medicines. If you have more than 6 months, you can take medicines. Hope you liked the video. Please like, comment, and subscribe. See you soon with another video. This is Dr. Shah.